Hello to all of my students. Today we're going to be discussing peripheral arteries of the lower extremity. This is part 1 of a series of lectures for which we will be going through the vascular assessment of a surgical patient. This podcast is meant for both the Year 4 and Year 5 students rotating through the surgical rotation. So the objectives are to review the anatomy of the lower extremity arteries and to apply these anatomical concepts to clinical practice. Peripheral artery disease is a major risk factor which results in limb loss and disability, which is rampant globally, regionally, and locally. Some well-established risk factors associated with this disease process are diabetes, high blood pressure, smoking, high cholesterol, a sedentary lifestyle, just to name a few. As such, knowledge of the anatomy of the lower extremity is essential in the clinical assessment of a patient with peripheral artery disease, in the interpretation of radiological investigations, as well as the execution and planning of surgical interventions. Now, we will do a pretest where I have identified 4 statements, and these 4 statements I would like you to determine whether they are true or false. So the first statement is, the midpoint of the inguinal ligament is used to localize the femoral pulse. Secondly, the femoral artery becomes a popliteal artery after it exits the adductor canal. Thirdly, the dorsalis pedis is a continuation of the anterior tibial artery. And finally, the posterior tibial pulse can be felt on the lateral aspect of the ankle. So I'm just going to give you a couple more seconds to just scribble quickly what your answers are for these 4 statements. And then we move on. This is a diagrammatic representation of a patient's thigh where we can see the inguinal ligament at the top of your screen, the femur, and the femoral artery colored in red. The femoral artery is a continuation of the external iliac artery as it passes under the inguinal ligament. It courses medially and gives a lateral branch, the profunda femoral artery, which goes toward the bone, and the medial branch, the superficial femoral artery, which continues along the thigh. At the distal aspect of the thigh, it exits the adductor canal, also known as the Hunter's canal, also known as the subsartorius canal, to become the popliteal artery. And thence it courses posterior to the femur and posterior to the knee joint. Clinically, the femoral artery can be palpated at a point half the distance between the anterior superior iliac spine and the pubic symphysis, and this point is called the mid-inguinal point. Additionally, the femoral artery is used as a site for needle punctures for endovascular interventions, as well as surgical exposure as inflow for bypasses in the lower extremity. Similarly, the superficial femoral artery can also be accessed surgically in the distal aspect of the thigh to be used for bypass procedures. This is another diagrammatic representation of the vascular structures of the distal thigh and leg. At the top of your screen, we can see the femoral artery exiting the adductor canal, where it is now called the popliteal artery, which courses posterior to the femur and the knee joint to enter the leg. In the leg, it gives an anterior branch called the anterior tibial artery, which courses in the anterior aspect of the leg toward the foot, where it is called the dorsalis pedis artery. The dorsalis pedis artery can be palpated on the dorsum or the instep of the foot. There is a medial branch which courses along the medial aspect of the leg toward the medial aspect of the ankle, and this branch is called the posterior tibial artery in the leg as well as at the level of the ankle. The posterior tibial artery can be palpated on the medial aspect of the ankle. This slide shows a 3D reconstruction of a peripheral CT angiogram. In this slide, we can see the distal aorta giving its two branches, the common iliac arteries, which then gives the external iliac artery, which continues as the common femoral artery. The common femoral artery then courses medially and gives the superficial femoral artery, which courses down the thigh to continue as the popliteal artery, which courses behind the femur and the knee joint to enter the leg. In the leg, it gives a medial branch, the posterior tibial artery, which courses a medial route toward the ankle, and the posterior tibial pulse can be felt on the medial ankle. The anterior tibial branch courses in the anterior aspect of the leg, which continues as a dorsalis pedis artery in the foot, and the pulse can be felt on the dorsum of the foot. So we now go to a post-test where we see the first statement, the midpoint of the inguinal ligament is used to localize the femoral pulse, is false, as the correct answer is it is the mid-inguinal point that is used to localize the femoral pulse. The second statement is in fact correct, as the femoral artery becomes the popliteal artery after it exits the adductor canal. The third statement is also correct, where the dorsalis pedis is a continuation of the anterior tibial artery. However, the fourth statement, the posterior tibial pulse can be felt on the lateral aspect of the ankle, is false, as we have seen, the posterior tibial pulse is felt on the medial aspect of the ankle. So in summary, we have reviewed the anatomy of the lower extremity arteries, and we have applied anatomical concepts to some clinical situations. I would just like to emphasize that knowledge of the peripheral arterial anatomy is the basis for which clinical evaluation, radiological investigation, and management